Dear viewers, different people do different things, but what is it when you meet a person who is a doctor, that is an orthopedic surgeon, a farmer, a musician, a golfer, and many more things? I have a person like that with me, Dr. Chandy. Warm welcome to the show.
Thank you.
Why did you choose to become an orthopedic surgeon?
Well, when I was a student in Bangalore at St. John's, in my final MBBS, I took a liking for orthopedics because orthopedics is a very physical field.
Okay.
You know, it's those who are interested in using the hands, making things, because it's dealing with bones, physical structure. I used to make a lot of things with my hands, right from catapults to whatever.
Okay.
And it's also very linear, you know, so you like straight lines, etc. Orthopedics, mechanical things.
It's biocarpentry.
Biocarpentry, you can call it,
Okay.
yes.
So, you actually are not an outsider to Bangalore.
I was born and brought up in Bangalore.
Okay. So then you finished your medicine.
Yeah, I did high school,
course.
college and medicine in Bangalore. And then I worked in orthopedics in St. John's and St. Martha's Hospital those days.
Okay, then you went off to the US.
I went to the US. I did my, continued my postgraduate education.
You were there for about 18 years.
I was in the US for about 18 years.
Okay. And what did you do there?
I did my postgraduate education in New York.
Okay.
At the Jewish Hospital Medical Center in general surgery, orthopedic surgery. Then I was an assistant professor at the same hospital. And then I decided to specialize in sports medicine and also joint replacement. I went to the University of Oklahoma. And there I did that training, and then I decided, my family and I decided to settle in Oklahoma.
Okay.
And I was a consultant there.
Okay.
And I was the chief of orthopedics at a hospital called Claremore Regional Hospital, Oklahoma, for 12 years.
Okay. Then you came back to India.
Then I came back to Bangalore.
Why did you?
Well, I guess that pull was always there. You know, 18 years is a long time. But the pull to come back, and of course Bangalore's my hometown.
What was there in Bangalore that attracted you?
Oh, I love Bangalore. I've always loved Bangalore, and Bangalore's my city. And I love India.
Most people went abroad to make money.
Yes.
But what kind of money did India offer to you?
Well, see, I came back in the early 90s. Those days there's not much money, but fortunately the liberalization was just beginning. Maybe I saw the writing on the wall. At that time I didn't think much about money. I had some savings from the years I worked there, and I put it all in starting Hosmat.
Okay.
And I didn't think about the money. I thought, okay, it will gradually grow, and I'm sure that my day-to-day needs will be taken care of.
Okay. Why was it called Hosmat?
Hosmat is an abbreviation.
I know, but why Hosmat?
Hospital for Orthopedic, Sports Medicine, Arthritis, Trauma.
Oh, it's to do with
HOSMAT.
basically, hospice or...
Pardon?
The word hos to do with hospital.
Was
that your interest, or it's because it had some neurological or some
No, it's just that I chose a lot of combinations, a lot of names those days.
Okay.
And
it really caught up quite well with the people.
Pardon?
People really, got attracted to the name too. That it got caught up with the imagination of the people, whoever came there.
I think mainly because it sort of met a need of an accident trauma center where you do take care of all accidents, whether it's head injury or bones, and then orthopedics, sports injuries, arthritis.
Hosmat became synonymous with bones, right?
Yes, it's an orthopedic hospital.
For a while.
Bones.
Yeah, but till then there was not a specialized hospital.
There wasn't. No.
And why did you actually think of doing this? Because did you actually know that it was going to work? Because there was a hospital like this in Bangalore, but in Bangalore, I mean, mostly general surgery.
Not in Bangalore. There was one in Pune.
Okay.
And this was more or less the second one in India. Mainly it's my field, it's my specialty.
Okay.
And since I wanted to come back, what next best is to start an hospital of my specialty. So I also wanted it to be a hospital of international standard. It was a dream.
Okay. But most of the hospitals that had general surgery, or most of the other disciplines too, had orthopedics as a part of it.
They continue to do so. Most hospitals will have a department of orthopedics, which may be a small part of the whole hospital, 5% or so.
Okay. But then orthopedics, though it was so important, it was not taken that seriously till people like you actually started
So orthopedics is a very
Hospitals
important
itself,
field
right?
because it affects your day-to-day life. Back pain, affects your arthritis of the knee, neck pain, hand pain. Mainly deals with movement, to be able to move. And if it affects your movement, that is orthopedics.
But there was a lot of difference between the way people thought about orthopedics and accident and trauma, right?
Yes, they used to think of it as just a broken bone, you go to a bone setter.
Yeah, it's not about replacement and...
The technology has changed tremendously.
yeah, because it's not just accident, trauma,
That's
repair.
right. That's right. It's reconstructive surgery. You can replace joints. You can do microsurgery.
Sling, splint, and all these things.
Those
You've
are
just
the
gone beyond all
old
that.
days. Yes. Now it's very sophisticated. You can do very minimally invasive surgery without actually opening the joints.
Okay.
And do a lot of surgery. We do computer navigation where it guides you to doing very sophisticated surgery with a very high precision. Hosmat has that, one of the 4 hospitals in India. So orthopedics has become very sophisticated. It's become less invasive, do much more microsurgery, and it's you can replace joints. You can treat all kinds of sports injuries. You can treat anything in the joints. You can you can fix a broken bone without even opening the broken part.
Okay. So it's all to do with the technology, not to do with the human skills or the doctor skills.
Technology, and the doctor has to learn the technology and has to, of course, practice and learn the technology and apply it.
Okay, so there is no space for the old timers at all.
No, there is space for old timers, definitely. And old timers, you'll be surprised,
They
are
adapt.
also learning because we have so many workshops and conferences, and they all come and they learn.
Okay, is the technology expensive or has it actually brought down the cost of operations?
The technology, you see, for example, when you do a joint replacement, the technology of the joint replacement is research by various companies on that. So the hospital doesn't do the research, doesn't incur the cost. But of course, there is a cost for the implant. The more sophisticated the implant and more long-lasting, the more expensive it is. But, US companies have subsidized the cost. I think it costs much less in India, the same implant, than what is sold in the US, maybe something like 50% less.
How safe are these replacement surgeries?
They can last 15 to 20 years.
But you normally talk about, unscrupulous doctors. To begin with, could be with urologists, but the second would be with orthopedic surgeons, because some people are in a hurry to actually replace hips or joints. Because
I don't think
that's quite profitable also for hospitals.
I don't think it's unscrupulous whether it's urology or orthopedics. Normally, there's a lot of medical. There's a lot of medical.
Is there something different with your
There's a
hospital?
lot of medical treatment in orthopedics, in joints, arthritis.
Okay.
It's only those patients who have such severe pain, or that they cannot function in the day-to-day. Say they cannot walk 50 yards. She cannot stand and cook, or cannot go to the market, cannot do a puja. And it's affecting the daily life, and has tried medical treatment and it's failed and is still having pain. Only those patients we do joint replacement, not in everybody.
For a long time, people thought you cannot actually get both the joints replaced at a time. Correct?
Yes.
And but still, nowadays, lots of doctors venture into.
Yes, we do it in Hosmat. We have certain criteria for doing both joints on the same day.
Okay.
One is the patient should be, say, below 65.
Okay.
Should be in reasonably good health.
Okay.
Should not have had a previous cardiac. Then we'll do 1 knee at a time. But even if we do 1 knee at a time, it's a difference of only 5 days. Those patients we do both on the same day should be reasonably good health and below 65.
Okay.
And should not be excessively overweight also. And it's also, the anesthesia is not a general anesthesia, it's epidural anesthesia. Only the legs are made numb. So it's not a very big strain on the heart as, say, anesthesia has also advanced to a great extent.
Okay, but when you undertake this kind of real risky operations, could be not just the knee replacement or the joint replacement, do you actually keep the patient in confidence? Because sometimes the patient may be having doubt about whether he or she actually needs these replacements.
It's all a question of discussion.
Okay.
And we give the options, medical treatment versus surgical treatment. And the patient and the family, we tell them, you go home, discuss it, think about it, and come back. and they'll come back, and we
Because
give them some literature
because it's
to
not
read.
just the operation, you need to think about recuperation, rehabilitation.
Yes, of course.
So
But we always give, in addition to discussing, we always give literature that we have made, handouts, whether it's in English or in Kannada, and they read it at home. So
Okay.
they will also, and many of them who are educated will access the computer also.
Okay.
So when they come back, they have a fairly good idea what is the post-operative recuperation, how many days in the hospital,
Okay.
when they'll go back to work. Then they make a sort of a judgment.
Because today physiotherapy itself is a very large area.
Yes,
and
physiotherapy
quite specialized.
can work wonders, especially
Yeah.
for back problems and certain stiff joints, etc. It always, physiotherapy and orthopedics always goes together. And surgery, when you do any surgery, whether it's a sports injury, arthroscopy, you do a microsurgery on the back, or a joint replacement, physiotherapy always plays a role.
Okay, it's not just orthopedics that you have in Hosmat, you also have neurology, don't you?
Yes, Hosmat basically
And
is
spine surgery too.
Yes.
Yeah.
Orthopedic
But why is spine not related to general orthopedics?
It is part. It is
Okay.
part of. But spine has become so sophisticated nowadays that we have a separate section called HISP, Hosmat Institute for Spine Problems, where we have orthopedic surgeons and neurosurgeons who work together as a team. Because the spine is both bones and the spinal cord and the nerves. Fortunately, most of the time, like when you have a slip disc, the spinal cord is, you don't even encounter that. It's far behind. It's you don't even come to that. So you're mainly dealing with the bones and taking the pressure off the nerve. So it's done by orthopedic surgeons or by neurosurgeons or both.
Okay.
Hosmat,
Most people are suffering from some or the other kind of bone problems, right?
It's very common.
Particularly after reaching a certain age in life.
See, 15% of the population have arthritis.
Oh.
Osteoporosis, which is the bone density coming down, the bone not being so dense, it's almost 100% of women after menopause.
Okay.
And men after 65.
Okay.
So it starts around the 40s.
So almost everyone, literally.
Yeah. So there are methods of preventing it, treating it. Most of it is, of course, surgery doesn't come into the picture.
Okay. Is there any kind of lifestyle somebody can put himself or herself into that you can prevent some of these, generally occurring?
Lifestyle changes that can prevent arthritis and osteoporosis. Osteoporosis, if you take, one is to be active. Physically must be active.
But how does it actually help your bones? Because
It helps. The bones, actually, if you're inactive, your bones become soft and weak.
Oh.
Just like if you put a leg in a cast and the patient doesn't walk, actually the bone weakens temporarily.
Okay.
Walking is important. Being physically active, whether it's just doing gardening, kitchen work, whatever.
Okay. You need to put it to use.
Put it to use.
Okay.
It thrives when put to use, number one.
Okay.
A reasonable diet with some dairy products, calcium. You don't need to take calcium except if you're, say, over 45, especially for women, 40, 45. And a little bit of sunlight, maybe a few minutes a day of sunlight.
Why?
Not direct sunlight, because the skin synthesizes vitamin D, D3 it's called, and that facilitates the calcium that you take to get to the bone. Otherwise, it doesn't get absorbed.
Okay. But that means many people actually don't know about how to take care of the bones that even helps them to stand up and speak for themselves.
That's correct. And there's a test called a bone density test.
Okay.
Can easily detect how sort of
It is
weak
done
the
with a
bone is.
biopsy or something?
No,
or
no.
Just like
It's just like a scan. It's a DEXA scan.
Okay.
And
What
it
are the
is
kind of equipments that you have today? The best ones?
in Hosmat? We got a very high sophisticated MRI scanner, which is an open scanner. We were the first one in Bangalore to have a non-claustrophobic or a non-enclosed MRI scanner. It's open. And it also doesn't have much sound at all. Then we've got a spiral CT. We have computer navigation in the operation theatre. We're one of the first in the country to have computer navigation, which guides you to doing a very precise surgery. Then we've got, in the operation theatre, we've got 4 C-arms, that's a TV X-ray. So when you're doing the surgery, you're actually seeing it on the screen.
Okay.
Then we have got a lot of microsurgery equipment microscope,
Okay,
surgical.
but you have the kind of doctors who can actually handle all these things.
Oh,
It's
yes,
not just sufficient that you have the right equipment, but
We've got a staff of 70 doctors in Hosmat. And senior doctors, we have about 40. Many have come from England, from US, from France, trained in India with good experience in the best institutions.
Has it helped you, once again to ask the same question, bring down the costs? Because, you know, sometimes some of these surgeries were supposed to be very expensive.
What you see, cost is always a factor because, you know, hospitals are facing huge costs and you know, you have to take care of employees and so many different things. So what we do is we try, the advantage is nowadays with less invasive surgery, patient doesn't have to be in the hospital that long. We can discharge the patient the next day for many surgeries. Even when I fix the broken leg bone, we make them walk next day, and next day or 2 days they're gone home. When I do a joint replacement, they can go home in 4 days and 5 days. Previously it used to be 2 weeks. So the number of days, that saves us the cost.
What about medicine?
Pardon?
Medicine, has there been some improvement? Some newer medicines,
in drugs,
medication,
yes,
particularly.
yes. There's a lot of medicines in, like say for example, one is osteoporosis, then arthritis medicines. That is anti-inflammatory, very sophisticated arthritis medicines to stop the progression of severe disabling arthritis. And you mentioned about the lifestyle, you know, how it can affect arthritis. Especially women when they have bow legs, you see, the bent legs like this. If it's detected early and corrected, then it doesn't lead to arthritis that fast. Overweight, if you're too heavy, you'll get arthritis, wear and tear in the knee.
What are the other related surgeries that you undertake here?
We have all the subspecialties in orthopedics, like hand surgery, all the industrial injuries.
Vascular.
Spine surgery, whether it's neck or the back. So many problems are there. Then we have pediatric, children's orthopedics separately. Then we have got trauma, which is broken bones. Then we have sports injuries, which I specialize in sports injuries and joint replacements a lot. Then medical and surgical treatment of arthritis. Then we have got what is called Ilizarov, external fixators to lengthen, you know, what to lengthen a limb. Suppose somebody has had an accident and the leg is short, we can lengthen it. Then we have got tumor surgery, orthopedic cancers. So you see, orthopedics is diverse. So many subspecialties now. We have got each of them in Hosmat. Then neurosurgery, neurology, and all the things related to trauma, accident trauma. You have to have plastic surgeons because you'll injure your face, you'll need skin grafting. Facial-maxillary, the bones of the face, when they get injured, needs a facial-maxillary surgeon. And neurologists, neurosurgeons to take care of head injuries. So eye surgeons, chest surgeons, all dealing with accidents.
It's a complete...
it's a comprehensive trauma accident program.
But you're happy with the way the hospital have shaped up today?
Yes, now we're in the 16th year and I'm very happy the way it is busy, it's very busy.
But where do you get your time for, get the time for farming, golfing, music?
Music is a very prominent part of my life from the time I was a child. And I do it after hours. You know, I mean, I come home at about 7
You belong to a band too, don't you? And you play.
Yes, I am the leader of a jazz band, 9-member jazz band. We call ourselves the Jazz Revival. We've been together for 7 years. I'm the vocalist of the band. It's good fun. And
since college days?
No,
no, I mean your interest in jazz particularly.
No, jazz. You see, jazz is you get interested probably after 35, 40.
Yeah, that's okay.
When I was in college, I had a rock band in Bangalore. You know, just for fun.
You've learnt music, or you just acquired
it? I learned music. When I was in college in Bangalore, it was all by year. When I went to New York, when I was doing my orthopedic training, I studied music formally at a college they called the Brooklyn Conservatory of Music. So I did it simultaneously. Then I learned to read music, and it sort of develops you more.
But you also collect musical instruments.
Yes, I collect musical instruments. That's from the time I was in the US. And
you have some strange...
I have some very unusual instruments. I have over 300 instruments, musical instruments. It's taken me 25 years of traveling all over the world and collecting it.
And you play some of them too?
I play a few
About
of them.
7 instruments?
7 instruments.
And you love the guitar?
Guitar I like the keyboard, I like the flute and the harp.
You play the Japanese flute too?
No, I don't play it. I just make a sound out of it. But it's a part of my collection. I have instruments from all over the world. It takes a big space, you know. 350 instruments take a lot of space.
And you also keep pets at home, don't you?
Yes, I have some pets, birds at home.
Varied interests. But you have this strange interest in farming, that you have a large farmland and you spend a lot of time there too.
Both my mother came from a farming family,
Okay.
and I have a farm nearby. And I spend Sundays, there, family and myself, and enjoy it. Grow trees,
Because
have
you
some
said you really like doing things
have some
with your
livestock.
hands.
I have a vineyard.
You said
and
you like doing things with your hands.
I like doing things with my hands.
So you work with the mud also, the earth rather.
Well, not directly. You
Okay,
need a lot of
supervising,
time for
get
that.
things
But
done.
I plan it out, and I have a lot of. It's a horticulture farm, and also livestock, and so it's good. It's enjoyable to see them growing from nothing.
Is it because that you're applying this principle that you need to be physically active to keep your own bones fit and fine?
When you walk around the farm and bend down, and so many things to do there.
Okay.
To take care of. It's
Okay.
it's enjoyable.
And most of the bone problems are related to lack of physical exercise, right?
Partly, see, when you don't have physical exercises, what we call a sedentary lifestyle, your bones and your back become weak. So you're more prone to getting back problems. You're more prone to, say, having a fracture easier than somebody who's active where the bone is stronger.
Okay. So does it mean that you need to do a specific kind of exercise, or just a limited amount of physical activity itself is sufficient?
Walking is a very good exercise.
Okay.
Walking at least, at least about 20 to 30 minutes a day. See, for general health, one is bone health and one is cardiac health. To get a good cardiac health, you need to walk about 45 minutes of fast walking 3 times a week.
Okay. Everybody speaks about sports medicine these days. And what exactly is sports medicine?
Sports
Or is it
medicine,
just like a glorified...
I specialize in sports medicine. That's what I did at the University of Oklahoma. That is...
How different is it from ordinary orthopedics?
Okay, it's a branch of orthopedics where you are basically able to evaluate an athlete very well, and with the minimum amount of surgery or physiotherapy, get him or her back to playing as quickly as possible. And if a surgery is necessary, do it with the least amount of, say, invasiveness.
Okay.
Do microsurgery or do arthroscopic surgery, and get the person back playing as quick as possible.
Okay, but how is it applied to any ordinary person?
Say for example,
specifically for a
say for
sports
example,
person?
you have a ligament injury to the knee, say from a motorcycle accident or from you fell down. Previously, in the 70s and 80s, this arthroscopic surgery was only for athletes and high-level athletes because it was expensive.
Okay.
Now we do it for everybody.
But it's called sports medicine, though.
Sports injuries. Sports medicine is a vast field covering so many other aspects.
What are the other things?
Like, say, for example, one is doping, one is sports psychology, one is human performance.
But you don't deal with sports medicine, you just deal with sports surgery.
Myself?
Yeah.
No, myself, I mainly deal with sports injuries, whatever it is, medical and surgical treatment, sports physiotherapy. Then the other aspects of biomechanics. Then human performance.
Is it basically understanding the ligaments and the muscles than the bones?
Because it's mainly the supporting structures, the soft tissues like the knee, shoulder, etc. The ligaments, tendons, cartilage.
Okay, but what is this ligament tear that people speak about quite often, which
what happens
is like most frequently heard these days than even a bone injury?
It's a very common thing.
Yeah.
The knee is totally supported by ligaments, unlike the hip, which is a ball and socket, so it's very secure. The knee is 2 flat structures, more or less, you can say. So it has to be supported by ligaments to be able to bend without coming out of place. So there are 4 major ligaments in the knee, and it can get injured, but it requires a certain amount of force, like a fall or something. When that is done, we decide whether the ligament injury is serious or not. Sometimes we do an MRI to determine that. And if surgery is needed, now there's a ligament called ACL, Anterior Cruciate ligament. And that almost always needs surgery in somebody who's below 50. That we do arthroscopic.
What do you do actually? You replace the ligament, is it possible?
We replace the ligament
How?
by, there are tendons around the knee. So that ligament, ACL, the body cannot heal it. Once it's torn, it's gone. So we replace it by using a strip of a tendon called a patella tendon in the front of the knee. It's outside the knee. So we take a strip of that without opening the knee and then pass it through the knee and fasten it by the arthroscopic method.
It is carpentry, isn't it?
In a way, it's
okay.
In a way, it's
but you also need to be physically strong to be an orthopedic surgeon.
yes,
Or,
and no.
or the technology
Yes
is
and
so
no.
better. That
Not true. Not true. When I was a student in Bangalore, my boss, who was an orthopedic surgeon, was big like I am, and you need to be physically strong to set the bones.
Okay.
You know, but now it's technology.
Okay.
See, like for example, women being in orthopedics in those days was unheard of.
Okay. Unthought of also.
Unthought of also, because you're supposed to be muscular and burly.
Yeah, yeah.
Even today, women are reluctant to go into orthopedics because the concept is there that you're supposed to be big and strong.
Okay.
But in the US, from the time I was a student there, it was only 2% of women went into orthopedics. Now it's 15% of all orthopedic surgeons are women.
Oh.
15%. In the US, it's still 1%.
Okay.
But it's, maybe the concept needs to change. That a lot of it is specialized surgery. You don't need force.
Okay.
Technology takes care of that.
Okay. But today it's more technology driven.
Yes, it is.
Okay.
Knowledge and technology, yes, both.
Okay. But are there newer things coming into this field that you need to constantly update
Yes. I just attended a meeting last in March in the US, and robotics is coming into the picture. Of course, in India it will take a very long time to come because it's very expensive, and a robot will actually do your surgery. But the pleasure is lost. The surgeon will just stand and watch.
Okay.
But it started in some institutions.
Okay. How was your childhood in Bangalore?
Oh, my childhood was very good. I was the youngest of 8 children. A lot of fun with so many.
Okay. And your father was an expert of roads and places in Bangalore.
Yeah, my father is a lawyer, and before Second World War, he worked in the Raj Bhavan.
Okay.
He was a legal advisor. And then Second World War, he was in charge of the entire rationing of petrol of Bangalore. Then he was a passport officer. Then in the early 50s, he was equivalent of what is Corporation Commissioner.
Okay.
Then he became Registrar of the High Court.
Okay.
And liquidator of companies. During that time, he wrote a lot about the history of Bangalore.
And you want to publish it?
Yes, in fact, he wrote in T.P. Issa's book
Oh.
on history of old homes in Bangalore.
Okay.
And he's written a lot of, in Deccan Herald and those days. I'm going to put it all together and publish it.
So do you have any other interests apart from these that I've listed?
Well, of course, I like to play.
Okay. Would you rather be known as a musician or as a surgeon that you are?
A surgeon, of course. Music is
because that allows you to be a musician.
Music is just a recreation.
because you really love music, don't you?
Of course.
And people actually know you sometimes in some circles more for your music than your surgery.
See, the music is occasional. We practice every week, but a performance maybe once in 2 months.
Okay.
And it comes on a Saturday. It doesn't interfere with my work.
Okay.
But it's very relaxing. And I find that music and surgery go together because both require very high hand-eye-brain communication and coordination, perfect coordination.
Okay.
So it helps. It helps to relax one person. It also creative. You're producing something. It makes you unwind. Most important.
But most of these hospitals that are even coming up, survive on the principle of scalability. But you haven't actually, you've grown in the same place, but you've not expanded and gone off to
we've
different
expanded.
places.
Now we are the largest orthopedic hospital
in the same
India.
place?
In India now.
Okay, but you're not started off branches or associating with other groups and all that?
You mean other similar centers elsewhere? No.
Yeah.
Recently we took over the next building, which used to be the ITI corporate office.
Okay.
Fortunately, they were very good in being a public sector and a hospital, so we merged our building and their building.
Okay.
And it's both a part of hospital. Now we've got 350 beds and 12 operating theatres. It's grown a lot.
What are your intentions as far as this hospital is concerned? What do you plan for it in the future?
The plan is to be basically a very prominent international and national level orthopedic hospital. We get patients from all over India. I take care of the Bangladesh cricket team.
Oh, okay.
And Mushraf Murtaza, who was a fast bowler, and I think they almost destroyed a batting in the World Cup final. I operated on his knee in 2002, arthroscopic surgery.
Okay. But why do we get to hear about these sports persons frequently suffering from injuries? Are they actually as obvious or as affecting as they are made out to be, or they're very fine things that we call them as surgeries or injuries?
The high-level athletes, of course, there's more publicity,
Okay.
and they do get injured because there's the stress of playing.
Okay.
There's a lot of playing.
But are there very fine injuries that you
many
that may not even
many athletes
qualify to be called as injuries per se?
See, any athlete will have a lot of small injuries, sprains, strains.
Okay.
And
that itself is called an injury.
it's an injury.
Okay, even if it's a sprain.
That's right, but
That's
it
quite
recovers.
common. That could happen to anyone.
It happened to anybody.
Okay,
Yes.
a twitch or a.
Oh, it's very common.
pull.
Very common. Everybody goes to sprains. and
But you make it such big news, and
the media does that.
oh, but it's not actually as serious because
No.
sometimes Tendulkar is suffering from a knee injury, but it could be just a pull somewhere. Sometimes. Oh, is that
See, for
so?
example, I treat all sports injuries.
Okay.
A cricket injury, you don't get as serious injuries as, say, a soccer or a basketball,
Okay.
because those are much more, they're called collision sports.
Okay.
where
But
you-
are there times that you really grade those injuries?
Yes, of course.
Like you say that this qualifies as something that requires rest, or this could allow
Everything
the
is
player to
automatically
play and all
graded.
that.
But you have a ligament injury that's grade 1 to 4.
Okay.
And a grade 1 is treated with...
Technology for that too?
No, it's your examination and clinical.
Okay.
There's technology. We have an instrument in the Hosmat called a KT1000. We're the only ones in India that have that can assess the ACL in the clinic.
Okay.
It's a very sophisticated gadget that can assess the ligament, whether your knee is moving like that,
Oh.
and tell the grade
Okay.
and whether the surgery is needed there and then.
Okay. So it's a state-of-the-art hospital today.
It has become, we have to.
Okay. And you still want to make it grow, and
Yes, of course.
it's a brand today in Karnataka, but where do you want to take this brand to? You say you've taken it to Bangladesh. As far as
No. We get patients from all over India now,
okay.
and from Bangladesh. And we have an international division now, a department, that medical tourism. We get patients from other parts of the world. I get American patients, Britishers, Japanese, Singaporeans. It's growing. That is growing.
It's very interesting to know, Doctor. Anyway, you have a lot of plans for your hospital. All the best. Thank you very much for
Thank
having
you
come
very
to this show.
Thank you.